Very important. Why? When you get back treatment, many of those treatments don't work. We've talked about this, to be exactly 100 times. I think today is our 100th video alive. Is it today 100? I'm going with it. All right. So our goal is to give you the tools. Our goal is to give you the tools so you can make better decisions about what's causing your back problem. Very often. And we've talked about this. This week, in the last 2 weeks, we gave you exercises and stretches. We gave you the prone, alternating, lower extremity. We gave you the double knee to chest, sphinx, squats, low trunk rotation, walking, my favorite, piriformis stretch, and the neurodynamic stretch, another one of my favorite. But I mentioned in every one of these videos that these are good for 60% of the population that has back pain, not so good for the other 40. And the question is why? Why is it doesn't work? Because again, you'll see on the internet, everywhere, it's not good information. That's why we do this. That's why we do this, okay? Our goal is to give you tools. But you see on the internet a lot of videos, oh, this is the best one for this is the best one for that. Okay, they're good for a certain percentage, but not everybody, because certain conditions actually are made worse. We give you a case study. We're going to give you a case study today so you can sort of see how this works in our experience, but there's a story here. And every case study tells a little bit of a story. This is case study number 1, huh? Number 1. Wow. First one. 41-year-old female, back pain and sciatica. 60 to 70% of our patients have sciatica. 5.5 years. Sciatica tends to be more advanced because it's really a compromise of a joint that's causing, a joint in the disc that's causing a pinch in the nerve. So, before this patient came to see us, had an MRI and an x-ray, did physical therapy, didn't work. She had this problem for 5.5 years, didn't go away. That's a lot of years. Tried chiropractors, didn't work. Cortisone injections, didn't work. Narcotics and anti-inflammatories, didn't work. And as I mentioned before, am I getting a glare? Don't give me a glare. As I mentioned before, this is a typical course of care. This is typically, if you have a back problem, this is kind of what you'll end up doing. Okay, but the problem is it doesn't work. Why doesn't it work? I'll tell you why. Because the problem is with the disc. When you have a pain that's not going away, the problem's the disc. Physical therapy is good for getting the muscles, if the muscles are out of balance, and we've talked about this, lower cross syndrome, upper cross syndrome, muscles are out of balance, you have to balance the load across the disc. You have to balance the muscles out. This is kind of the goal right here, get the muscles the same on both sides. Physical therapy is very good for that. But it doesn't affect the disc. It doesn't affect the disc. Chiropractic, really good for the joints. What it does is it allows for the joints to move. You need motion. Doesn't affect the disc. It does at a little level, but not at a high level. Okay, if you have an advanced problem, it doesn't work. This is, again, the evolution of back pain treatment. Cortisone injections. What do? They inject it into the facet joint, these little joints in the back, but they also inject it into the area where the nerve is being pinched, in and around the disc. Decreases inflammation. Doesn't heal the disc. Doesn't affect the disc. That's why the exercises don't work. That's why chiropractic doesn't work. I've had 3 or 4 people this week say, I've got a herniated disc, what do I do? Okay, if you have a disc problem, these don't fix the problem. Okay, narcotics doesn't fix anything. Flat out doesn't fix anything. Lowers the pain intensity, but makes you, it's highly addictive. 33,000 people die every year as a result of narcotics. 20,000 die as a result of a prescription written by the doctor. Here's for your pain. They OD. Dead. It's pretty, I know it's pretty extreme. So not a good idea. Anti-inflammatory, same thing. Decreases the inflammation, doesn't fix the problem in the disc. We have a 9-step process. And really, what is the 9-step process? Here's the magic of the formula. Here's what we do. We stabilize the disc. We take pressure off the disc, and what we have found through our research, 2 sets of research, one found that we can actually affect the disc, the other one found that it affects the disc better than anybody else. This is the most recent research. We're going to talk. We're going to do a bigger video about this next week because there's some confusion about what this research says. It says that our treatment's better. Why? Because we affect the disc. Patient came in, spondylolisthesis, herniated disc, degenerated disc, bulging disc, sciatica. It's pain that went down the leg. Went through the program. We know that the herniated disc is pinching the nerve. All the reasons. Spondylo is where the vertebrae shift a little bit. Degenerated disc, vertebrae getting close together, pinching the nerves. Okay, bulging disc. Again, these are all disc problems. Disc problem, joint problem, and a disc problem. Herniated disc problem. Okay, these are all disc problems. Every one of them is a disc problem. Bulging disc problem. Herniated disc problem. We affect the disc. All those other things didn't work. Why didn't they work? Because they don't work on the disc. Back pain treatment is changing. It's evolving. This is the next step. We have identified through our research that we can affect the disc. When she came in, her back pain, she had 30 treatments, okay? That's important to know. These things, it doesn't get better with one treatment. 30 treatments. Back pain was a 9. Oswestry Disability Index was a 42. Went through the program. At the end of the program, back pain, leg pain completely gone. Oswestry Disability Index was a 16. Okay, what do we know? Anything above 40 is a surgical candidate. She was a surgical candidate. Well, what does that mean? Typically, the course of care is some sort of medicine, and then it's maybe physical therapy, and if that doesn't work, then maybe they'll do injections or do chiropractic, and then if you fail all those, you kind of wind up in the office of the surgeon, which is kind of what the new clinical protocol is that was sent out to the American College of Physicians, that you have to avoid the medicine and you have to avoid the surgery because it's not effective. We talked about that, the five causes or the 5 most dangerous trends. Right now, fusion is number one most dangerous trend because it's just not effective. We know that everybody 40 and above is a candidate for surgery. Average patient that goes in to see an orthopedic surgeon, their oswestry is a 46. The average patient that comes to see us, their average oswestry is 47, and they get better. Why? What's the difference? The difference is we affect the disc. We affect the disc. We've identified that the disc problems get better. So if you did all the exercises I give you, if you're not getting better, it's because it's the disc. There are some exercises that take a little bit of pressure off the disc, just like chiropractic takes a little bit of pressure off the disc, but it doesn't take enough pressure off, and you don't get enough healing in the disc. We have the ability to take pressure off and get healing. That's what we do, okay? Today's Friday. That was my Friday rant. I didn't rant as much as normal. It's only 5 minutes, so we're almost done. If you like what you hear, I want you to share this information with people that might benefit from what we do. Okay, a lot of people have a problem. They don't know what to do. Have them come see us. Subscribe to like our Facebook page. I was doing pretty good till just now. Like the Facebook page, share the information. That's what I want you to do. If you're on YouTube, subscribe to my channel and share it. Also, any channel you're on right now, I want you to, if you have any questions, ask the questions. A couple people this week wanted me to talk more about their MRI. We're going to do that Monday. We're going to talk, because there are 2 people who had the same exact problem, and they both want me to talk about it. So we're going to talk about it. What does it mean? What does it look like? How to read an MRI. We're going to do that Monday, I promise. We absolutely have to do that. We can't change it, no matter what I say. So we're going to do that Monday, and then so you'll have a better understanding. But what I want you to do is, in an area where the social media that you're on, that you can ask a question, in the comments below, ask the questions. We will answer the questions. Okay, we'll either do it right in the where the comments are, or we'll do another video about it, because I want to know what you need to know. My goal is to change the world. See, now it's taking longer than I should have. Change the world, and we can do it one spine at a time, but the way I do it is answer your questions, because we have answers. You just got to ask the questions. That's it. I'm out. It's Friday. He's out. Oh, he's pointing. We're going to put a video link right here if you're on YouTube, right? So click on that link. It's going to be another video that is super informative, because that's what we do here. I'm out. Have a good weekend, and be careful. And be safe. And wear your seatbelt, because it's the law. We fix the disc.